you can see in this picture it is a linear immunofluorescence. So one case where you get this linear immunofluorescence is good pasture syndrome. So here in good pasture syndrome, it is an autoimmune disorder. That means here it is a type 2 hypersensitivity reaction. It is an autoimmune disorder, type 2 hypersensitivity reactions. And here actually antibodies are formed against the alpha 3 chain of collagen 4. Alpha 3 chain of collagen 4. So these are the important points about good pasture syndrome, and we know that it's glomerulus and pulmonary, that is both lungs and kidney are involved, and it is mostly affecting the men, young men, and the risk factors can be smoking, some viral infection, or those who are working in dry cleaning industry, that means hydrocarbon solvents exposure. So these are the important good pasture syndrome, and it should not be confused with good pasture disease. It is another one which is affecting elderly females. So this is good pasture syndrome, and the management is done by plasmapheresis. So the manifestations, of course, hemoptysis can be there. This is hematuria can be there when glomerulus is involved, and when lungs is involved, hemoptysis can be there. So as a management, it is plasmapheresis. This is an autoimmune disorder. So I hope all those are clear. You can see that it is an autoimmune disorder and type 2, then alpha 3 chain of type 4 collagen, all these points. Now at the same time, when we discuss good pasture syndrome, I think it is important to discuss about Alport syndrome also, because here also one type of collagen is there, that is type 4 collagen. In good pasture syndrome also we have discussed about this, that is antibodies are formed against alpha 3 chain of collagen 4, but here it is there is a defect in the alpha 5 chain of collagen type 4, alpha 5 chain. Alpha 5 chain of collagen 4. So this is not an autoimmune disorder. Here there is no antibody. It is a structural defect. That is why you cannot get any immunofluorescence here. So there is no immunofluorescence. To remember, this is an electron microscopy finding which I have been shown here. This is an electron microscopy finding which you can see here. There is an basement membrane. There can be thinning, thickening, and there is a lamellated appearance. So that is the basket weave appearance of glomerular basement membrane which is seen in Alport syndrome. Okay, so here also mostly affected it is males, and most common extrarenal manifestation, it can be sensory neural deafness. So it can affect kidney, it can affect ear, it can also affect eye, anterior lenticonus can also be there. So among this, in renal manifestation you can get hematuria. So I would like to write that here. It can affect kidney, eye and ear. So extrarenal manifestation, which is most common, sensory neural deafness. In eye it is causing anterior lenticonus. Okay. So when it affects kidney, the earliest feature that you can get is hematuria. So mostly it is affecting males than females, and this is a structural defect. Once again I am saying this is a structural defect, not any problem with the antibody. So you cannot get any immunofluorescence in this Alport syndrome. Okay. So this is Alport syndrome, basket weave appearance and basket appearance, and this is good pasture syndrome, not good pasture disease. So this is good pasture syndrome because you are getting a lot of manifestations related to kidney and related to lungs. Okay, so I hope it was fine. Thank you so much.